Welcome to this pep talk of the Alliance for PH. The letters PEP stands for Patients Empowering Patients, and I hope I can empower you a little bit today. My name is Louise Bouman. I am 48 years old, almost 49 actually, and I'm married, a mother of two, with a dog completing our family. I live in the Netherlands, and in 2008, shortly after giving birth to my second son, I was diagnosed with PAH. For the past 7 years, I have been a president of the Dutch Pulmonary Hypertension Association and recently became a board member of the Alliance for PH. Today, I want to share my experience of living with IV pump therapy with prostacyclins. When I was diagnosed with PAH, I was in functional class 4. I couldn't move at all without becoming completely breathless. I had just given birth to my youngest son naturally in a peripheral hospital before I even had a formal diagnosis. At that time, my oxygen saturation was dangerously low, requiring me to be on 15 liters of oxygen per minute. After delivery, I was completely exhausted. I couldn't do a thing. Even brushing my teeth was horribly tiring. When I was in the expert center, the pulmonologist told me that my only option was IV prostacyclin therapy. They started a treatment immediately, but at first I felt even worse than before. The initial weeks were incredibly tough. It felt like having the flu on top of my disease. With each dose increase, I experienced extreme fatigue, flushing, palpitation, and just general discomfort. But as I neared my target dose, things slowly improved. I felt less tired, less breathless, and a little bit stronger. After a few weeks, I was sent home with a mobile pump. But before that, I had received extensive training, and I had to convince my PH nurse that I was capable of managing the pump myself and handling it in emergency situations. Managing an IV pump while caring for two young children and a dog was a real challenge. Being connected to the pump 24/7 made everyday activities like showering, getting dressed, bathing my children, lifting them, and even sleeping much more complicated. Well, you can see on the slide that it's a complicated thing and you have a lot of lines and a lot of stuff with you. On top of that, I had to be constantly vigilant. Would the alarm go off? Were my batteries running low? Did I have enough medication cassettes stocked? Whenever I left the house, I had to double check. Did I pack a spare pump? Did I have extra lines, gauzes, batteries, etc.? And also, did I have my medication cassette with me and would it stay cool? Was my medical passport with emergency numbers in my handbag? Despite all these challenges, I gradually adapted to my sort of new normal and accepted it because the improvement in my health was undeniable. I no longer needed extra oxygen, my resting saturation was normal again, and I even could take my kids to the playground without immediately running out of breath. I could even manage some household chores and had enough energy to see my friends again, what was also a relief. But at the same time, my family and I had to accept that life would never go back to how it was. I could no longer achieve the goals I once had or change the dreams I had envisioned. So I had to start all over, setting new goals and redefining my dreams. And the pump became both my best friend and my worst enemy. How did I overcome pump challenges? Well, taking a shower became much easier after my husband installed extra hooks in convenient spots around the bathroom. This allowed me to hang the pump in a dry and clean place. I also made sure to keep the insertion site protected at all times by covering it with sterile wound films. I did that always. And when I took a shower, I never directed the shower jet directly to the film. Additionally, just before showering, I secured the connection between the two lines with waterproof tape for extra protection against water. Preventing my kids or my dogs from accidentally pulling on the line was another challenge. Over time, I became actually a true expert in using silk tape. I'm a very big fan of silk tape because it feels the nicest on the skin, actually. And a few tips I learned along the way. The adhesive of the tape works better when it's warm. So after applying the tape, rub it gently to improve its grip. And you can do that for a while. You see that it's going better after a while. And also make sure your skin is not too cold when applying it. Never apply the tape under tension. It can cause really painful and horrible blisters. Instead, I always created some sort of tunnels by forming a loop of tape around the line. This allowed the line to move slightly without pulling on my skin. And for the ladies, use your bra for extra support. Wearing it over the infusion line helps to keep it secure. I also made sure that no loose lines were visible because my dog and my kids, well, I didn't want them to pull accidentally. Any excess length was wrapped around the pump and stored neatly in the pump bag. This greatly reduced the risk of any accidents. Staying vigilant was another challenge, but I found ways to make it easier. I kept one dedicated bag with all my essentials, so spare pump, batteries, gauzes, extra infusion lines, my medical passport, and more. After each use, I immediately replaced any items to ensure the bag was always ready to go. To avoid forgetting my medication cassette, I set calendar reminders on my phone. I also stored all emergency information on my phone, so it was always at hand. Staying vigilant was another challenge, but I found ways to make it easier. I kept one dedicated bag with me with all my essentials: spare pump, batteries, gauzes, extra infusion lines, my medical passport, and much more. After each use, I immediately replaced any items to ensure the bag was always ready to go. To avoid forgetting my medication cassette, I set calendar reminders on my phone. I also stored all emergency information on my phone, so it was always at hand. Staying vigilant was another challenge, but I found ways to make it easier. I kept one dedicated bag with all my essentials: spare pump, batteries, gauzes, extra infusion lines, my medical passport, and more. After each use, I immediately replaced any items to ensure the bag was always ready to go. To avoid forgetting my medication cassettes, I set calendar reminders on my phone. I also stored all emergency information on my phone, so it was always at hand. In the Netherlands, pre-filled medication cassettes are available from the pharmacy. In the beginning, this meant I received deliveries every 2 days. However, after a while, I wanted the flexibility to prepare the cassettes myself. This gave me more freedom. I didn't have to stay home waiting for deliveries, and I could travel beyond the Dutch borders again. It also provided more security in case of emergencies, since I could prepare extra medication myself instead of relying on urgent pharmacy deliveries. A nurse from the company that supplied my pump and medical materials came to my house for 5 consecutive days to teach me how to prepare the medication safely and hygienically. I practiced under his supervision until I was confident in handling everything on my own. Being less dependent on others was such a relief. Traveling beyond the Netherlands became possible again. I mostly traveled by car since I had to carry so much medication and supplies. Flying was an option, but going through customs with all my medical equipment was stressful, I can say. At the end of 2021, treprostinil via an implanted pump was officially approved as a treatment option in the Netherlands. As soon as I heard about it, I researched all the details and created a pros and cons list. I sent this list to my pulmonologist and asked if this could be an option for me. He was a little bit hesitant because his motto is always never change a winning team. But since I was well prepared and fully informed about the potential downsides, he agreed to support my decision. The transition from epoprostenol to treprostinil was done in the hospital. Since there's no exact dosage conversion, the switch required careful fine-tuning before the pump could be implanted. Fortunately, the transition went very smoothly and I didn't notice any significant differences. A few days later, I underwent surgery and the implanted pump was activated immediately. The Hickman catheter was removed during the procedure, and just 2 days after surgery, I was allowed to go home. It took me about 2 weeks to fully recover and get used to having the pump in my abdomen because it was a little bit heavy and huge, and you really have to get used to it. I have never regretted my choice. It has had an enormous positive impact on my quality of life. Now I only need to visit the expert center every 28 days for a refill, and aside from that, I don't have to do anything, and that's really a relief. No more carrying around supplies, no more constant vigilance, no more preparing cassettes, and no more worrying about empty batteries. Leaving the house is so much easier now. Spontaneous trips are possible again, and even flying is stress-free. Of course, there are also some disadvantages of this switch. Um, the pump requires surgery under anesthesia, which is not ideal for a PAH patient and is not possible for everyone. Refills must be done at the expert center every 4 weeks. So you can't go for a long vacation. You have to be back before your next refill. If the pump malfunctions, emergency surgery is required. And in the meantime, I would have to go back on the external IV pump. Over time, the pump starts to infuse medication faster, reducing the refill interval to every 3 weeks. And it goes faster again, then you have to go back every 2 weeks. Once refills are needed every 2 weeks, the pump must be replaced. Also, the pump is not available in all European countries, which could be a problem if it fails when I'm on vacation. Since I have a little belly fat, the pump is pretty visible under my skin, though I can cover it with clothing. On the other hand, for people with more belly fat, refilling the pump can be more difficult. The summary of my story is yes, living with an IV pump is very challenging, especially in the beginning. But over time, you adapt. And with a bit of creativity, you can still do a lot of things you love. I even managed to go to a climbing park with my kids. For me, switching to the implanted pump was a huge improvement in my quality of life. I'm an active person, and this treatment suits my lifestyle much better. I love being as independent as possible and having the freedom to travel and take part in all kinds of activities. However, I know that this option isn't available in every country and isn't suitable for every patient. And then my take home message for you is strength is not the absence of struggle, but the ability to keep moving forward despite it. Thank you very much for watching and have a very nice day.